Hello, everyone. My name is Laurie LaComb. I'm the Healthy Schools Coordinator for Douglas County School Districts.
And I'm Jamie Montoya-De Smidt. I'm the Prevention Coordinator for Douglas County Schools. And we would really like to welcome you. And we want to go over a little bit of housekeeping before we get started. So first, just so you know, this webinar is being recorded and it will be available online. In addition, the presentation along with the web links for the resources that we'll talk about this evening are actually going to be shared out and emailed to you in the next couple days. So this is something that you can refer back to, but also that you can share out. On top of that, we are going to have the opportunity for you to ask some questions at the end of our presentation. And so there is a question and answer box. And so we will invite you at the end of our presentation to take some opportunities to ask questions. And, you know, we do realize that we may not get to all of your questions, but we will try and make sure that we capture those and then get back with you. So, you know, really our goal is to provide you with parents some great information in kind of what I like to call bite-sized and digestible portions. And so what that means is we're going to be limiting our webinar to half an hour. And the reality is, like, we're both parents and we know how challenging this time can be. You're working at home, schooling at home, all of it. And given that, we chose a time frame of 30 minutes. And with that comes some limitations, which includes not really being able to have robust discussions. At the same time, we do want to hear from you. And therefore, we will take those responses and questions in the question and answer box. But, you know, please understand, we may not get to all of your responses. On top of that, we realize there may be questions or feedback that you might have about remote schooling or any of those kinds of things. And we know that those are important concerns. And at the same time, you know, the information that you received from Dr. Tucker in his emails or the information on our social media from our communications group is really the most current. And so you know as much as we do in relation to where you might be or the information that you might have in relation to these concerns. Finally, if we don't get to your questions immediately, please know that it's important. And if you want to follow up with us, the presentation actually does have our contact information. And so you can follow up with us that way. And now we're going to get started.
All right, so let's walk the talk of social emotional learning here. How's everyone doing this afternoon? First, let's just take a few deep belly breaths to anchor ourselves to the present moment and maybe help relieve any built up stress for the day. So find that mindful body and sit up kind of straight and take a nice deep breath in through your nose. And then let it go. Let's do that 2 more times. Inhale through the nose. Let it all go. One last one, best one. Now think a little about how you are feeling right now. How's your energy level? How happy are you feeling? Maybe close your eyes if you feel comfortable with that and just experience how you're feeling in this moment. I'm just going to give you a couple moments for that. And if your eyes are closed, go ahead and open them. And Jamie, let's explore with you a little about those thoughts in the quadrant we have up on our screen.
Yeah, so, you know, I want you to consider that you see these 4 quadrants here. And many people right now are spending a lot of their time in that red or blue quadrants. And kind of given the shifts to online learning, your needs to work from home or deal with maybe employment uncertainty, the needs of your new coworkers, or as we call them during our off work hours, our children, and they're working at home and trying to adjust, and the needs of our teachers as they balance out their needs to get their own children's education happening, but also teaching their students. All of this can be really quite a bit to deal with.
Hey, Jamie.
Yeah.
Sorry to interrupt. That was such great stuff, but we can't see the presentation.
Oh, got it.
Sorry, everybody. First timer. We're working on it. We're doing our best.
Oh.
This really great quadrant. You're going to love it. It's worth the wait. Jamie might need to take an extra breath.
Yeah, I do. Just a second. There we go.
Not coming up yet. Ah, there we go. Yay, Jamie, thank you.
So yeah, sorry about that.
It's all right.
So that's that initial quadrant. And so right here, as I was saying, a lot of people are spending time in probably this red or blue quadrant. And, the reality is there's a lot that's going on. So much so that I forgot to share my screen out. That's the kind of stuff that's going on, right? And, the reality is that, this can be a lot to deal with. And the reality is that it changes from day to day. And sometimes it feels like it changes from hour to hour. And this kind of COVID-19 experience can be really challenging. And, we're going to fluctuate in between these different areas. And I would invite you that this is a good time to give yourself permission to not be too hard on yourself during these times. Just like you're probably providing and giving a lot of permission and grace to other people in your life, including your children, I invite you to give this grace to yourself. So when we look at the things that can be stressors, I want you to consider that there's a lot of stressors that can have an impact. So some of them are things that I mentioned just a bit ago, but it's also important to keep in mind that the way that I handle stress is very different than how my 8-year-old daughter Lulu handles stress, or my 12-year-old son Jude handles stress, or my wife. The reality is like we all handle stress in really different ways, and it shows up in our behavior or actions and can appear to have like even different levels of intensity. So it's important to give one another grace. Research has demonstrated, as has my work in my previous private practice work and counseling work with students in schools, that we have to first acknowledge our stress. We really have to do that first and foremost. We have to, if you will, give it a name and identify it and how it's affecting us so that we can move from operating in what is commonly known as fight, flight, or freeze positions into a prefrontal cortex way of thinking, reasoning, planning, executing plans, accessing our working memory. So, throughout the district, we, along with the staff at your children's schools, work intentionally to provide really an access for your students, both with information, but also skills to understand what happens in their brain when they're dealing with stressors, and then provide them with effective strategies for managing their emotions and stress. Like the breathing exercise that Laurie started with at the beginning of our session, it's important to take deep breaths. And now Laurie's going to provide you with a deeper dive into the brain and the neural processes involved when we're stressed.
So let's explore a little about what's happening in the brain and the body when dealing with stress. So all information comes through the brainstem, and it's going to stop in the midbrain. And the reason it stops there is that's where our amazing security system dwells. That's, in fact, when we work with little kids, we say it's our security guard or our security dog. There we have our amygdala, our hippocampus, and our thalamus, and they work together to make sure we can handle the information that's coming in, or should we switch into the fight, flight, and freeze response. So when the brain receives input that's threatening, stressful, or emotional, the brain sends messages to the body to create cortisol and adrenaline. Therefore, it's not flowing that information to the prefrontal cortex, what Jamie was just talking about, which is the area that's responsible for focus and socializing and planning and decision making and blah, blah, blah. So when we get really stressed, our body kind of takes over, and then we have to help the brain come back online, so to say. So in order to manage our stress, we have to acknowledge that we're experiencing it, why we're experiencing it. And this is one of the social emotional competencies that we try and teach our students, which is self-awareness. So Jamie, you want to go to the next slide? There we go. So what you're looking at right here, there are 5 social emotional competencies outlined by the collaborations for academic and social emotional learning, which we refer to as the CASTLE model here in Douglas County School District. The wheel on this slide is a framework that we are utilizing as a basis for our SEL instruction throughout the district. And we realize that so much of a child's social emotional learning happens at home through parent model roles, or role models, community involvement, family systems. We also know that we need to explicitly and implicitly teach these skills to our children. And those skills, if you can see in the orange, you've got the self-awareness and self-management, then the social awareness and the relationship skills, which those all together can help us lead to really good, responsible decision making. And as you can see, as the circles around this wheel, it involves the homes, community, schools, and classrooms. So when we are faced with stressors in our lives, for example, switching to online learning at home, well, we need to start with self-awareness and start really thinking about, how does this affect me? How does it make me feel? Do I have the resources to deal with these changes? Because from there, from that awareness, we can use our strategies to reduce the stress and adapt to these changes. Because we have such a short amount of time, we just wanted to focus on 2 strategies with you tonight. And the first one's self-care, which I'm going to talk about, and then sources of strength, which is really Jamie's wheelhouse. So first and foremost, you are the best role model for your child. Bottom line, it starts with you. So taking care of yourself is part of taking care of your child or your children. And they need to see you model these self-care strategies and talk about them so that they can do it for themselves. And it's really important to know that everyone deals with stress differently. Everyone finds strategies that work for them, but it might not work for someone else. So just being really aware that everyone needs their own space and time for it. So these are the 3 self-care tips that we decided might be helpful. We know you're being inundated by a lot of self-care information out there right now, but the first one we wanted to talk about is media intake. And we ingest food daily, and we try our best to be cognizant of what we eat. Although during these COVID times, it's a little challenging. But are we being aware of how much we're mentally ingesting? How much social media we're ingesting? How much of the news are we ingesting? Because we want to really try and find a healthy balance of information to help educate us through these times, but not too much that it furthers us into that stress place, into that red box and that blue box that we showed at the beginning. So really just, maybe just taking a little, self-assessment on how much media intake is going on for both yourself as a parent and your children. The second self-care skill is called Name It to Tame It, a skill that I learned through Dr. Dan Siegel, who's a mindfulness and parenting expert. And Name It to Tame It means name the emotion you are feeling so you can help tame it. And emotions matter. And our first step is identifying what we are feeling. So, for example, the other day, my son was feeling super flustered and it was very physical, tapping and moving from place to place, place to place. And finally I said, so what's going on? And we started going, well, I'm not feeling comfortable. I'm just feeling overwhelmed. Well, why are you feeling overwhelmed? Well, I didn't get this done. Oh, I'm starting to feel a little guilty about that. Well, now we're starting to get to the feelings behind it. So let's deal with it. And then the last one I love, which is called purposeful pauses. And the idea is that we really want to set ourselves up to respond to situations rather than react. Response is more thoughtful. It really gathers more information, and a reaction is just that kind of really visceral, very quick, like, it could sound like a yell or a scream or whatever. So really thinking about how can we bring purposeful pauses throughout our day so we are calm. So we did that breathing activity, that's one. But a purposeful pause would be something you would do during something you already know that you've planned for the day. Like I have been drinking an excessive amount of water over these COVID times, and I just know that I'm going to go fill up my glass of water once every hour or two. And that is a great time for me to pause, take a deep breath, maybe go out on my back porch, watch spring pop up around me, pet my dog, maybe, hey, go check on my kids, and just take a little moment the brain can only handle so much. So we got to give it a little downtime. So really consciously thinking of some purposeful pauses during your day. So let's end with just one other little self-care activity that could be part of your purposeful pause, which is 7-11 breath. And we'll just do one round of it. So we just come back to that mindful body, and we're going to inhale for 7 and exhale for 11. So blow the air out through your nose or mouth. Inhale 2, 3, 4, 5, 6, 7. Exhale 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Take a normal breath in and a normal breath out. And now, Jamie, you want to share your sources of strength work with us and those amazing resources?
Absolutely, Laurie, that was great. Thank you.
Oh, thanks, Jamie.
So Sources of Strength is a model, and I want to share about it from a social emotional wellness perspective, as it is one of our models being utilized by many of our middle and high schools. And while some of you may be familiar with this model as one of our suicide prevention programs, it is first and foremost an upstream prevention program and wellness model. So across the literature, related to effective support for individuals at risk, what we in prevention call a protective factor, sources really goes to work with that. And a protective factor means something that supports our well-being and growth and protects us from risk factor behaviors. And that, like, number one most effective way to protect someone from risk is being connected. It supports our well-being, it supports our growth, and Sources of Strength is all about connections to others. Sources is also about approaching adversity, or what we call like tricky situations, from a strengths-based perspective and being explicit in developing these strengths, like really going to work on them and identifying. So the Sources Wheel really helps young people and adults to approach a situation, especially ones where there's adversity, from a place of hope and help and strength. And so the 8 areas of the wheel are family support, positive friends, mentors, healthy activities, generosity, spirituality, medical access, and mental health. And so, when you go to work and you explicitly identify what these things are and how you access these areas of support, but also how you build them, the research and through interviews, it's been shown that these are things that help people get through adversity. And that's kind of how the Strength Wheel was created. So you might wonder though, well, okay, well, but how do I use this? Well, first of all, I would contend that we want to make sure that we model healthy habits. Laurie was talking about that just a little bit ago. And, so for example, you might be talking out loud about your strengths and modeling what that looks like. So as an example, I might find myself and I might notice, wait a second, I'm kind of frustrated. So I might say, you know what, guys, I'm really frustrated right now. I think I'm going to step away and, I'm going to connect with one of my friends, Phil, and I'm going to get on the phone with Phil and we're going to just talk a little bit. But I think the other thing is supporting our students in those connections. And, as an example, maybe you're going to have daily check-ins or you're going to support them in connecting with their friends. So as an example, my daughter Lulu, we make sure that the girls have an opportunity. Her best friend Sage, they've been in class together since kindergarten. And, right now, this has been challenging for them and they miss each other. And so they have started to create what they call, this was their words, which blew me away, a reunification party. And so it's really kind of fun. They've planned out their menu. They've planned out their guest list. My daughter actually created a blueprint of our house by walking around and sketching our house and where they were going to set things up. And so the other thing is you can schedule time for healthy activities. Now I'm going to share, Sources has created a number of great resources. I'm going to share some of those resources on how you access different parts of this strength wheel. And so you'll find the link for this in our presentation when it gets sent out, but they have a page called COVID resources. And so one of these things that's kind of fun is this thing called daily activities. And what they've done is basically help you create a schedule of ways to engage with, or what they call work the wheel and practice growing your strengths. And so they've got a number of fun activities for the morning that are in that family support, positive friends, mentors, healthy activities, generosity, spirituality, medical access, and mental health areas. They've got fun activities to take on throughout the day. So that's their morning activities. And then they have afternoon activities, and they even have evening activities. Another kind of fun activity that you can do is in this. Oh, just a second. I'm going to come right back to you all and share my screen out.
Jamie, I really like
Yep.
that one where you send the baby animal video to a friend.
It's good, isn't it?
That's a good one.
Absolutely. So this is a gratitude journal. And we actually started our gratitude journals in my house about 5 days ago. And so really what we do after dinner is we name 3 things that we're grateful for. Research has actually shown that after 21 days of taking on a practice like this, it actually changes our brain chemistry. It changes the way that our brain works and the way that we look at the world, but it also helps with the reduction in some of those stress hormones like cortisol that Laurie was talking about. And so I invite you to take the opportunity to do some journaling or gratitude journaling with your family. You may be really surprised at some of the things that show up in your conversations. And
wonderful. Thanks for sharing those, Jamie.
Absolutely.
Amazing.
And so you can see right here in the presentation now, there's the home resources link. There's that building throughout the day kind of calendar. This is a 21-day gratitude challenge. There's also a great video. So if your kids are like, we're going to do what and why would we do that? This is actually a great video, an experiment in gratitude, and kind of a neat thing to watch as a family. And then there's also some exercises for building resiliency. And there's some tools and exercises that are included that aren't sources of strength activities, but are very much connected. And Laurie.
Well, this COVID-19 is really proving the fact that we are all so connected to one another in so many ways. And this is truly a time for us to shine. And there have been signs of this everywhere. Neighbors making masks for hospital workers, positive messages and sidewalk chalk along the paths, shopping for elderly neighbors, Zoom chats. Yesterday, I saw my neighbor, he's all dressed in Hawaiian gear. I'm like, Sheridan, where are you going? He goes, I'm going to a Hawaiian party online. Like, just these great ways to find joy in our days. So as you continually work to find your new normal in all of this, share your successes with others and soak in these times that have forced us to live with less. Focus on the family, focus on the friends, and take this opportunity to creatively grow with these changing times, thus building our resilience for future challenges. Jamie and I really wanted to take a moment to shout out to our amazing Douglas County School District, the teachers, the admin, the school staff, our district department. Everyone's working so hard to provide meaningful learning experiences for our students. So we thank you. And please give some grace to all, especially yourself, as Jamie has pointed out, as we are all navigating these ever-changing times. So now is a great time for any questions, and also if there are any topics that you would like us to cover in the future, if you wouldn't mind putting that in the Q&A below. We did get one very nice comment from one of our participants. Nara, thank you very much. She's appreciating the balance of finding the balance of our own approach to social and emotional care at home. So thank you for saying that. So we'll just give you a second or two to see if anyone has any questions.
No, thank you for that, Kelly.
Thanks, Olga.
Hey, Olga. Oh, we're going to actually send out the presentation to you. So you'll actually receive that in your inbox in the next couple days. And you'll actually be able to, it'll be in a PDF format. And so you can share that with other people. The question was, where will the PowerPoint be? You're going to receive that. But then you can also link to all of these additional resources as well.
And feel free to reach out both to Jamie or I for any resources, anything you might need. We might not have the answer, but we might know someone who does. Thank you, Sherry. We will keep your topic on our list. And thank you, Zach, for your continued support. All right, I think we're good, Jamie.
Excellent. Well, thank you everyone for your time this evening. We really appreciated you, taking 30 minutes. And our intention is to provide this opportunity weekly. And so we would encourage you to invite other folks. And, we'll always be circling back around to kind of those social emotional skills, but we will have different content, and we're even gonna have some different folks coming and sharing with you. So thanks everybody.
All right. Bye-bye. Have a great night.
Have a great evening.